Hi, Mr. Logan.
Hey.
I'm Dr. Kavanaugh.
How you doing?
It's nice to meet you. Welcome to physical therapy.
Yeah.
Your doctor, he sent me a referral on you, and on the referral it tells me that you had a spinal cord injury.
Yeah.
Okay. Can you tell me a little bit about that?
What do you want to know? I broke my friggin' back.
Okay. How did that happen?
I was in a car accident. You know.
Okay, great. So did you have any other injuries in the accident?
Jeez, I busted up my arm pretty good. My ribs got broken. Cuts all over my face.
Okay, good. So you went to the hospital, I take it, and how long were you there for?
Oh Jesus, at least a month, I think.
Okay.
I don't. Yeah.
Okay,
Something like that.
and then you went home, I take it. So are you back at your own place again?
No, I'm living with my parents.
Great. That's really good. You know, the research shows that if people have a lot of good family support, it makes the recovery a lot better. So that's really good.
Yippee.
How about are there any? Do you have any past medical history that I need to know about?
What do you mean?
Things that before the accident, did you have any diseases or any other problems?
Nope, I didn't have nothing like that.
Great.
Stitches or whatever when I was in high
Okay,
school.
so you were pretty healthy?
Oh yeah.
That is awesome.
Wicked healthy.
All right. Well, another good sign for you, because research shows that people who are pretty healthy before they have a big accident like this one actually do better.
Let me ask you something. Am I going to be walking today or trying to friggin' do something, or am I just getting the 20 questions?
Well, I don't know if we'll get to walking today, but walking is definitely something that we can talk about. I'm sure we can help you with that.
Like, you know, I asked the doctor, and he's like, he won't give me a freaking straight answer, and I gotta get going, get working, get my life back.
Okay,
quick,
I understand. I mean? Yeah, sure. It's good to get back on your feet again. Okay. Well, let me ask you: do you have any medications that you're taking?
Dude, I take the Oxycontin there, and whatever else, some friggin' pills they give me there.
Okay, it sounds like you're having some pain then, huh?
Oh yeah.
Oh, okay, so on a scale from 0 to 10, can you 10 is the worst pain you've ever had, and 0 is like no pain at all. What's your pain number today?
Like what part of my body? I mean,
well, just
my arms
generally.
Like 8. I can't even, get it out.
Oh, okay. So
hurting, dude. I'm hurting.
So 8.
Yeah.
Okay, that's good.
That's what I said.
Okay, what about allergies?
What does that got to do with anything here?
Well, sometimes if people have allergies to things and they're having problems with their allergies, it can actually interfere with their recovery. So it's important for me to know that.
Yeah, you ain't got nothing to worry about with me, dude.
Okay. So who's with you at home, did you say?
My mother and my father, my younger brother.
Okay. Great, and they're helping you out?
Yeah.
Okay, that's excellent. How about your discharge and vocational plans? What are those?
I don't even know, what do you mean?
I'm sorry, discharge plans, so what you're going to be doing after you finish with your therapy programs?
You mean like going to work?
Yeah.
Yeah.
Okay, what kind of work were you doing before you got hurt?
I'm a welder.
Excellent. Okay.
So I'll be doing that, ASAP.
Right. Okay, good. Well,
that'll be good.
Let me just ask you a few more questions.
Jesus, you already asked me enough, man.
Well,
let's,
I'm
here to do what move.
Okay, well, it's just a couple more. What I really want to know is what goals do you have for physical therapy?
Didn't I just freaking tell
Hi,
you
Jim.
that?
Hi,
I was
Valerie.
in the building and I heard Todd was here, and I was wondering, can I just ask him a couple of questions? I hate to interrupt your therapy session, but
Sure.
felt like while I was here, might as well get it done.
Sure. Todd is he's coming to us. This is his first day in therapy.
Mm-hmm.
He broke his back several months ago. He was an inpatient at the other hospital, and now he's been home for about a week, and he's here. This is, like I said, his first day in outpatient therapy. So help yourself. I'll come back in a few minutes.
All right, I'll just take a few minutes. So, Todd,
Yeah.
I'm just here. I'm Valerie Jones, and I'm the social worker here at the rehab, and just want to ask you a few questions.
What do I need a friggin' social worker for
Well,
right now?
we're here to help you get on the road to recovery because we need to set up some service for you at home.
Yeah.
And so that's what I need to know. I need to know about your living situation. So why don't we start there? I see that your discharge date from
I
the
just told the
hospital
guy-
was December 23rd. Is that right?
Something like that. Yeah,
Okay.
I don't.
Okay. And can you tell me about your living situation now? Where are you living?
My living situation pretty much sucks, all right?
Okay.
Friggin' parents, they're trying to wait on me. I'm living with them. I'm not into it. I just want to get going, get working, get moving.
Okay.
Get
So are you
things going.
living in
My
a...
girlfriend, she's barely fucking talking to me anymore.
Okay.
You know.
So
Let's go.
you're living in your parents' home. Is it just you and your parents?
No, I already told Bill or whatever there that I got a younger brother too who lives there.
Okay.
He ain't too happy about this. It's really bumming him out.
Okay.
Friggin'
So
bumming me out. My
they're there
parents.
to support you.
Yeah. What do you
Okay.
mean? Yeah, I mean, but they don't know what the fuck they're doing. I don't know what I'm doing.
Okay.
You know.
Now, were you living with them prior to your accident?
No, I was not living there. I had my own friggin' apartment right in the old port.
Okay. Did you live alone, or did somebody? Did you have a
Girlfriend
roommate?
lived there with me.
Okay.
We have to, she can't live there, she can't afford it herself, so we have to rent that place out,
Okay.
give it up. So
Let's see. Can you tell me? Are you on any medications right now?
I just fucking told that guy earlier what it was. I'm not gonna sit here and repeat everything over and over.
Okay, we really want to help you. We want to
Good.
help you get on
Let's
the road
get it
to
going.
recovery, but we need to have these questions asked and answered. So,
Whatever, they
Can you
gave me
tell me what-
morphine for a long time while I was
Okay.
in the, the little pump thing.
Yeah.
Now I got Oxycontin pills,
okay.
some other shit they gave me, I don't.
And is this a change for you? Were you on any medication prior to your
No.
accident? Okay.
How's it going?
It's going good. I think I have all I need for right now.
You're gonna get me going here today?
You bet. We
Yeah.
sure are.
Yeah, good.
So Todd, I'll be speaking with you again because I don't want to take up any more of your time.
All right.
So thanks for talking with me, and I'll see you again.
Yeah,
Great.
all right.
And we'll talk later about that.
That sounds great. Thanks,
Okay,
Jim.
You bet. All right, just a few more questions. I think I asked you about your goals for physical therapy, so can you tell me about those?
What do you mean? I just freaking told you I want to walk.
Right.
Well, that was you, wasn't it?
Yeah, you told me about the walking. What kind of walking
Come
do you
on,
want to
dude.
do? Indoor walking, outdoor walking?
Put my legs, but walk. I don't need to run. I don't need to play basketball. I just gotta get up, get going, get the working going, get my freaking girlfriend to give a shit.
Okay.
You know?
Okay, well that sounds pretty good. I'm sure I can help you with that. All right, just one more question. Do you have
Oh
any...
my God, dude.
Well, just one more. It'll just take a second.
Hey, Jim.
Hey, Valerie.
Heard we have a new outpatient coming in today. Good
Yeah,
to see you.
Good to see you, too.
And I thought we could talk just for a few minutes.
Sure.
I have a few concerns.
Is it Todd Logan?
Yes.
Yeah, okay.
Yeah.
What do you know about him?
Well, I understand that, in reading the notes from the hospital social worker, he was in an accident, pretty severe accident,
Right.
and sustained some life-changing injuries. And that's just kind of the beginning. His twin brother, who he was very close to, died in the accident.
Okay.
And he has since, due to some insurance issues, have been discharged and is having to do the remaining therapy on an outpatient basis. He's moved back in with his parents, and from the notes, it sounds like he is a pretty independent guy, and so I think he's struggling with a lot of things that might interfere with his progress.
Okay.
As far as physical therapy.
All right, well that's really helpful. I don't know very much about him. I know he had a T12 burst fracture and a left radial fracture, and so what I'm guessing is that he wasn't able to get very far in his inpatient hospitalization, so he may have not actually had a chance to really try some of the things that they were going to try to teach him at home, so I'm not really sure sort of where he's going to be in his recovery. We'll have to find out.
Yeah, the other thing too is I'm not exactly sure what his expectations are for his recovery. So that might be a challenge for us as well.
Okay. Well, when he comes in, if you're in the building, just stop on in and we'll talk to him together.
That sounds great.
Okay.
Thanks.
Hi, Mr. Logan. I'm Jim Cavanaugh.
How you doing?
It's nice to meet you. This is your first outpatient visit, right?
Yeah.
First time here?
Yep.
Your doctor, Dr. Smith, he didn't send us a whole lot of information. He told us that you broke your back and you broke your arm.
Yep.
And so I was hoping that you could tell me a little bit more about the injuries that you had and some of the things that you did when you were at the other hospital.
Don't you have that like on a piece of paper
Yeah.
somewhere? I mean, I've been
Yeah.
telling this friggin' story to everybody.
Yeah, it's unfortunate. The computer system that we use doesn't communicate with the hospital one. So
Yeah.
just give me the brief story. You don't have to get into all the details. Just
What, how it happened and all that crap?
just whatever you want to tell me is fine.
Well, me and my brother, we were driving. And, we crashed the car on Thanksgiving.
I'm sorry to hear that.
Yep. Fucking sucked, you know. Trying to get through it and, see what we can do.
Yeah.
But, yeah, so broke my back, my friggin' arm, and my life's a wreck right now.
Yeah, you seem pretty upset.
Yeah. And so
I
I just want to get to the walking part, get moving forward.
Okay. Well, I know that's why you're here, and that's what we're going to work on.
Yep.
I wanted to tell you that one of our social workers here at the clinic is also going to be part of our team that's here to work with you. She's going to be stopping by in a few minutes to join us, if that's okay.
Yeah, whatever. I mean, I don't see what a friggin' social worker is going to do for me to get my legs going, but
Right. She's kind of our support system. She's good. She's got a lot of resources that she can help us with. So.
well, whatever.
Okay.
So, you know, let's just get it going, whatever.
Okay.
Hi, Jim.
Speak of the devil. Hey,
Hey,
Valerie.
Mr. Logan?
Yeah.
I'm Valerie Jones. It's nice to meet you. Mind if I join you?
Whatever. I mean, I was telling Jim that, you know, I don't know what the hell I'm doing here if I ain't walking. I don't want to be talking, to be honest with you.
I can understand that.
Yeah.
It sounds like that walking is really your priority, and I'd like to tell you why I'm here and how, you know, I may be able to help you with some different resources that will make your progress a little quicker for you. And that is to kind of set up maybe some services for you at home so that you can work on your walking there too.
I ain't gonna need none of that at home. So I'm gonna be walking, you know, here in, I don't know, a couple months probably. I've been reading about it online. I know I'm gonna walk, so I don't need that.
Okay.
That's how I feel, you know.
Yeah, I understand that. Do you have some support at home? People that are there to help you, work with you?
Yeah, I mean, my mother and father are there, and my girlfriend now and again comes by, but you know, my little brother, he helps me out a little bit.
What kind of things do they do for you? Are they helping you move in and out of the chair? Or?
Yeah, all that shit.
Yeah.
That getting out of the car and, you know,
Is that easy?
brushing my teeth, believe it or not. I can't reach all the way up. You know,
Okay.
I can't do
So they're
the fucking
doing
thing,
a
really.
lot, right? Okay. How is it? That doesn't sound like it's a very easy situation. Is it a big challenge whenever they try to help you? Are they doing pretty well with it, or do you have any sense about that?
They don't want to be doing it. I mean, they like, you know, they love me, but this sucks for everybody, you know.
Okay. All right. Well, as soon as we can, get you on your way, that would be that's what we're going to try to do for you, so that you don't have to rely on them so much anymore.
That'd be good. I gotta get out of there, really. I gotta get my, get another apartment, get my girlfriend to give a shit again, because she's starting to fade on me, really, So,
Does she come to visit you?
well, she did last week. I ain't seen her this week. I mean,
And
she called my father, and it's his cell phone, but just checking in on me, but it's like I don't really expect her to hang around, but I don't fucking know. It just sucks,
You've had a lot of change and loss since this accident.
Yeah, I have. Yep, let's get going on this, let's use some of this equipment, let's lift some weights, let's fucking do something. I'm done with this sitting and talking shit.
So what can we help you with? Where would you like to start?
Well, can I get up right now and, get going with, I can't even really push myself up too good, but...
Okay. Do you have any movement in your legs at all?
No.
Any feeling in your legs, in your rear end, anything like that?
No.
Okay. When you were in the hospital before, did they stand you up with some piece of equipment?
Yeah, some, crane thing or whatever.
Mm-hmm.
Yeah, I kind of remember that, yeah.
Okay.
So...
You all right?
Yeah, I'm great. I mean, good times, yeah.
Yeah. Okay. Well, let me tell you a little bit more about what we're going to be doing here in therapy, and see if that makes sense to you. And we'll work together and come up with a program to get you on your way.
That'd be good. Like I said, I'm a welder, and I got to get back to work. My buddies are going out partying without me. I got to get some shit going on in my life. I'm gonna go crazy. I'm starting to drink. Honestly, I'm starting to drink a little bit too, Phil, more than I used to.
Okay. All right. So maybe I'll finish talking with Todd, and then next time the three of us will get together and we'll set out a plan together, and then we'll take it from there.
That sounds good. And in the meantime, if you think of things that might be helpful to you outside of your appointments here, for you or your family, that might feel supportive to you, please know that you can call me anytime.
Yeah, I forgot your name.
It's Valerie Jones.
Valerie, okay. Yep, well, I don't know what the fuck I'm doing, really. I'm here. Just trying to do what I can do to get through it.
Yes, it's a long process.
I appreciate your time.
Well, it's good to meet you, and I'll be checking in with you again. Okay?
Thanks, Valerie.
You're welcome. Take
Okay.
care.
Why don't we take a look at the room here and show you some of the equipment that we got, so we can talk about how we're going to get you back on your way.
All right.
Okay, come on over this way.